Hello, this is Phillip Adler, manager of the sports medicine program for the Spectrum Health Medical Group. I want to take a sports medicine moment to talk about concussions. Now, I know what you're thinking, concussions, yet another story on concussions, another video blog or more information on concussions. Well, concussions, much like other topics in the past, continually evolves. So we need to continue to be up to date on our concussion management information. Now is the time we should be working to get our baseline concussion testing done to make sure that all of our concussion injuries and head injuries from this past season, whether it's baseball, softball, or soccer, let's make sure those things are clear so that we can enter the fall sports seasons clear of any head injury issues and we don't have any second impact syndrome situations. So I do want to highlight Dr. Axman, our sports medicine physician, non-operative sports medicine, and Dr. Lawrence, our sports neuropsychologist, do work in our sports concussion clinic, and they will be seeing athletes throughout the summer, working on baseline concussion testing, taking care of any of the old injuries, making sure kids are ready to go. Athletic trainers in the schools will be performing their baseline concussion testing, making sure that we have current and valid baseline tests with the neuropsychological testing. So again, preparation in the summertime leading into the fall is a huge asset so that we can be safe. But then what do we do in the event of a concussion? Concussions happen. We can get hit in the head by a baseball or a softball. Soccer and other sports do take place all year round. So I think being aware of the signs and symptoms of concussions is really important. And then not only knowing the signs and symptoms, which we seem to have been bombarded with lately, but what do we do in the event of a concussion? How do we handle that? Who do we go and see? And so there's a lot of information out there. The important thing is to make sure that you're taking care of it. You're not brushing these things aside, because we could be brushing aside something that's going to really affect us when we get into later in the summer or fall athletic activity. Most important, I think, after we get back from a concussion, now that a lot of us know what the concussions look like, is return to play progression, taking the time to ease back into sports, whether they're contact or non-contact, working up to capacity, making sure those concussion signs and symptoms don't return. And again, we have experts in the sports medicine program that can help if there's any question, but it's being diligent with sons and daughters about their head injuries and not taking for granted the headaches and the things that they might be telling us after a game.